right, Mr. Kim, so what brings you in today?
Well, I'm here to get my diabetes checked up on, and I have some weird thing going on in my left ankle as well.
Okay. When you say you want to get your diabetes checked up on, how have your sugars been?
I haven't been checking them quite as frequently as I know that I probably should. But when I have been checking them, maybe in the morning around 250-ish zone, and a little bit higher than usual, I know.
Because usually they're around 180s, right?
Yeah, for a while they were actually doing a little bit better than that because I lost the weight and stuff, but lately I just haven't been able to really adhere to the medication regimen maybe as well as I should be.
How often are you checking a day, would you say?
I maybe check every 3-4 days.
Every 3 to 4 days?
Yes.
And when they're 3 to 4 days, it's 280s, 300s. What's the highest it's been?
I don't think it's ever gone over 300.
Okay.
But it's gotten pretty close on occasion.
Oh, that's good. Okay, and then what medications are you taking?
Just taking the oral thing to lower my blood sugar. I forget
Okay.
the name of it off the top of my head.
Probably metformin.
Yeah,
Okay.
metformin. And then, I take the insulin injections as well.
And how many units are you injecting? Are you doing 3 times a day or just once a day?
I'm supposed to do it kind of like before the meals, but again, I'll admit that I've been lately kind of forgetting to follow that regimen.
And how's your diet been?
It is kind of a concern of mine because I am pretty happy with the weight loss that I've been able to achieve over the last year or so, but I haven't really been shopping at the grocery store, I'll be quite honest with you. A lot of it's kind of takeout and fast food, and I know that they're not healthy, it's not a healthy diet, and I really am afraid it's going to lead to weight loss, and I feel it might be making the diabetes worse as well.
Yeah, so eating more processed food, more fast food, and then doing the insulin about once a day. Does that sound about right?
Sometimes twice.
Sometimes twice.
Yes.
Okay. All right. And tell me about that wound on your ankle.
So I just noticed it the other day. I don't really remember doing anything. I don't remember injuring myself, but I have a coffee table in my house, and I think that maybe some morning I was kind of moving around the house and just kind of bumped into it and just kind of left a nasty wound there. I think it might have been there for a week or maybe more. Like I said, I just really noticed it the other day, and it doesn't seem to be showing any signs of healing up.
Really?
That's my concern.
Is it festering at all? Is it bleeding?
No, it's just is kind of red and drippy, for lack of a better term, and just doesn't seem to be healing up. Like, I've had cuts and bruises in the past, and they always seem to take care of themselves pretty quickly. This is that's why it's a concern. I didn't know maybe it's related to some of my blood sugars being out of control.
Well, let me take a look.
Yeah.
I'm taking off your shoe and stuff. Yeah, that does look. I can see it's not really healing right there. It's not very deep, but the good thing is it's not purulent. I don't see any, pus from the area, but it is concerning that it's been there for a week or two and it's not.
Yeah, that's my best
healing.
guess.
Have you been wrapping it at all?
No, like I said, I just noticed it the other day, and I have just been kind of keeping an eye on it.
And you've had
Trying to keep it clean.
Okay, good. And you've been using like an antibiotic ointment, or?
No, just kind of keeping it clean.
Okay. And you haven't had any fevers?
No.
No fevers, no chills?
No.
Okay. And any areas of redness around this foot that you've noticed? I don't see much right now, but...
Not that I've noticed. It seemed to be pretty much localized to that one area.
Okay. All right. And you've had I'm just going to go through the general medical exam at this